One of the toughest challenges we face in IVF today is when the uterine lining is too thin. Without a healthy lining, even the best embryos cannot implant, and that can be heartbreaking for patients. In most women, the endometrial lining naturally grows thick every month, 8 millimeters or more, 3 laminar on ultrasound, and this makes the uterus receptive for embryo implantation. But for a small group of women, the lining just doesn't grow well. Why does this happen? Sometimes it's due to past uterine infections like tuberculosis. More commonly, it's the result of surgical procedures such as ADM, C after a miscarriage. These procedures can damage the endometrium, sometimes permanently. And when the problem comes from an unnecessary DAMP, C, it's especially tragic because a medical abortion would have avoided this risk altogether. So, what can be done? Some clinics are now promoting experimental treatments like stem cell therapy or PRP infusions into the uterine cavity. In theory, this sounds promising because stem cells help regenerate tissue. But in practice, the results have been disappointing. Unfortunately, many clinics still offer these treatments commercially, even though in India all stem cell therapies are officially classified as experimental. That means ethical doctors should not be charging patients for them. If you do want to explore these options, it's best to participate in clinical trials where you are not financially exploited. The safer and more reliable next step for patients with thin linings is a hysteroscopy. This allows us to look inside the uterus, check for adhesions, and see how much scarring is affecting the blood supply to the endometrium. We can try higher doses of estrogen or medicines like vaginal sildenafil that improve blood flow. Sadly, these options often don't work as well as we'd like. And for some patients, the reality is that surrogacy may be the only practical option to achieve a baby. Conclusion AMP, reassurance, dealing with a thin uterine lining can be frustrating and emotionally draining. I know patients often feel desperate to try anything. But it's so important to separate real hope from false hope. Don't let desperation push you into spending money on unproven treatments. The best thing you can do is to be well informed and work with a doctor who is transparent and ethical. If you're struggling with a thin uterine lining and want clear, evidence-based guidance, I'd be happy to help. Book a video consultation with me, and together we'll go through your reports, your history, and your options so you can make the right decision for yourself. Remember, information is power. The more you know, the more in control you'll feel on your IVF journey.